Throughout my career, I've been very interested in this very rare but lethal condition called malignant peritoneal mesothelioma. I became interested in this many years ago because I was struck by the fact that in the oncology field there was really quite a nihilistic perspective on this particular condition. No one really had any effective treatments for it. We were interested in seeing if we could develop a strategy of using surgery as well as chemotherapy applied directly into the abdominal cavity to try and control the growth of mesothelioma within the abdomen. Mesothelioma is generally thought to be caused by asbestos exposure, although there are other risk factors associated with it. And there are two fundamental types, one that grows primarily in the chest cavity and one that grows in the abdomen. And my own area of interest has been in the abdominal form of this disease. It only affects several hundreds of people in the United States every year, but once it is diagnosed, it is really considered an incurable condition. What we found is that when people undergo surgery to remove as much of the mesothelioma as possible from the abdomen and then apply a high dose of intra-abdominal chemotherapy, that many individuals did quite well for a very long period of time, and we were really struck by these findings. At the same time, there was a group of individuals who did not do well. So my laboratory and I have been studying this condition, and over the years we have systematically collected tumors from individuals who have undergone treatment, and we've studied these in the laboratory. We've studied them using very sophisticated molecular techniques, and we have been able to find really quite remarkable insights into the nature of this cancer. When you study a tumor by looking at it under a microscope, it's like trying to understand the personality of a cancer, like people in a room being looked at from a plane